So treating other symptoms of MS can also affect your mobility. So we mentioned the spasticity, fatigue. So we talked a lot about those exercise and pacing, and those things are critical. But when an individual is doing that, if their fatigue's still limiting their day, there are medications. And the medication modafinil and the medication amantadine both have some good research studies that show they can help fatigue in MS. And sometimes we use other medications as well. It's also important to have a medical assessment related to your fatigue, because maybe your fatigue is related to something outside of your MS. Very frequently people come in and they say, well, I tell everybody I'm fatigued, and they tell me that's just my MS. And often that is the answer. But as clinicians and people who take care of individuals who have MS, one of the important things to say is there anything else going on? Often we'll find out somebody's thyroid is under or overactive, which can contribute to fatigue. Or maybe they're not breathing well at night and have a condition such as obstructive sleep apnea. So these are all factors, or the bladder's not working well and they're getting up to pee several times. These are all things we have to investigate, because often those can be treated, that can relieve the fatigue, and that can have a positive impact on mobility. So just some conclusions before we open up for questions. So we know that mobility declines as MS progresses, but we also know that no matter what level of impairment that you're at, there are things that your healthcare team can do for you and help you do for yourself that can improve your mobility. So that's whether you're walking or not walking, or no matter what point on the pathway with your MS that you're on. It's important to get properly assessed so that you receive the best program for your individual needs. And it's important to keep an open mind. There's new things happening all the time. Ask questions, and don't be afraid to try new things like exercise. So I guess I can't use that shoe excuse anymore. What if my socks don't match? Okay, so if I can't find matching socks, I'm good. All right, good. And most of all, never lose hope. There's so much happening right now in the world of MS and our understanding of MS and the things that help with MS symptoms, like things with mobility. And so it's really important to always keep that hope. And just when you think there's nothing left to offer, something like a new drug like famotidine comes out, or better understanding of how exercise helps MS symptoms.
Thank you very much, Dr. Short. That was absolutely fabulous. It's so interesting to hear the new things that are going on with research in different areas, whether it's medication or in physical activity, and how we combine all of those things to improve the quality of life of people who are living with MS. And I just want to thank all three of you lovely ladies for your presentations this evening. Dr. Short, oh my gosh, Paula, I was thinking Pam, but that's not right. Paula Green and Susan Ehler, thank you very much. We did have a couple of questions sent in earlier on, so we'll start with one of those, and then if there are questions in the house, we can do that as well. Okay, so this first question is a little long. It says, part of my mobility issues seem to stem from my iliopsoas muscle in my right hip. I receive regular massage and osteopathic treatments and on that day I have the treatment, I can take a few steps. Is there an injection such as Botox that will keep this muscle from tightening so quickly? When my therapist releases this, I have a lot of involuntary movement as my leg bends from the knee without having to move it manually. So.
So first would be to really review that exercise and make sure you're maximizing that, okay? And then a good review with physiotherapy or with a physiatrist or another physician who's comfortable with the sort of muscle and bone and joint issues to examine that hip and see if there's anything going on that's maybe causing that muscle not to work well. That's certainly a muscle we often see spasticity affect, and so spasticity medications for management could be helpful for that problem. And so that might be a medication by mouth, but also if it is a really localized problem and there's not a lot of other muscles with spasticity as a difficulty, absolutely botulinum toxin might be something that we use to inject and help that muscle. Okay.
Good. Are there any questions in the house? Has anybody written a question down that they'd like to have addressed, or do you have a question that you'd like to ask? And I would ask that if you do, that you just stand up and give us the question if you can, and then we'll repeat it for everybody to hear and get it on the microphone. But try to make the question a general one rather than something specific to something diagnostic for Dr. Short. That's not really what we want to do tonight. Any questions in the house?
I was wondering, it's a question for chairability. Have you ever thought of coming to Halifax?
So it's a question for Susan Ehler and her program chair ability. And the question is, have you ever thought about setting up a program in Halifax? Not to put you on the spot.
Not at all. Yes, I have thought about coming to Halifax. If I could make my days about into 28 hours a day rather than 24, I could probably manage that. It's just a time thing. I would love to have a second program in Halifax. If I could find someone and train them to run a program in Halifax, that would probably be more feasible than me running another program. I'm actually going to Middleton next week to get a program going down there, but I'm going to get that group, just facilitate them, and they're going to run their own group. So if we could do something like that in Halifax, then by all means I would be certainly willing to work with someone if we could find someone to run that Halifax program. But unfortunately it's just a time constraint right now. Not because I wouldn't love to. Sorry.
I noticed that Dr. Short's last slide had a fellow with doing some stem cell work, but had a bunch of flowers in his head. We did have a question about stem cell therapy and what role it might play in MS treatment.
So I hope this is on. So stem cell therapy, of course, is one of the big areas when we talk about hope in MS, that there's really a lot of promise in research. And what you need to remember about stem cell therapy is the breadth of it is huge, and there's different stem cells and different ways to get them into the body and different ways to help them with the nervous system. There's certainly a lot of evidence in the animal models that different ways of doing stem cells can be helpful. In humans trials, the big one right now is the bone marrow transplant that a lot of people have been reading and actually participating in. And in Ottawa is sort of one of the biggest sites where they're continuing research in that. And certainly for people with relapsing remitting MS that's progressing very quickly, this has been a helpful therapy. We still need to know more information. We still need more research to know safety and efficacy in humans. There's with the bone marrow transplant, of course, they have to wipe out your whole immune system and then try to rebuild it. And people can die from that. That's a side effect of that treatment. So trying to find safer ways to do that, better ways to do stem cells, that your body's going to be more likely to accept them, like using your own cells as stem cells. Are things that are being researched right now. So a lot of things we're seeing at the animal level are very exciting. If one of my neurology colleagues was here tonight, they'd probably be able to expand a little bit more. It's still a big jump to humans, but they're certainly making inroads that way. Okay.
Another question from the floor. Anyone? No? Okay, in that case, then I will bring this to a close this evening. And once again, I'd like to thank Dr. Christine Short, Paula Green, and Susan Ehler for their presentations this evening. And also like to thank you all for coming here and joining us in this evening's presentation. Again, our session was possible through unrestricted grants from Novartis Pharmaceuticals Canada, EMD Serono, Biogen IDEC, and Teva Canada Innovation, and we thank them for their support. Again, thank you all for coming tonight. I hope you found it helpful and useful. I found it fascinating. I mean, I was really kind of interested in how that lady was walking across the room after having a couple of shots. That's very, very hopeful. And also the Fampradine and how that could make a big difference in people's lives. So it's just so tremendous to know that so much research and so much work is going on to improve the quality of life of people who are affected by MS. And we're thrilled to have you in our communities. It's just really terrific. So again, thank you so much all for coming tonight, and thank you to our three ladies.